So right now we want to talk about your health. Trillium Health's annual Health Assessment Day is just a few days away, and joining us now, Andrea Demeo from Trillium Health and Dr. Bill Valenti. Welcome to you both.
Thank you.
This is coming up Friday.
Yes, it is.
And I know part of the goal here is, so many times people say, if only I'd had something checked out sooner. You don't want those if-onlys to continue, right? This is about being proactive, isn't it? Tell us about the day.
So a little bit about Trillium Health. We're located at 259 Monroe Avenue, Monroe Square. And Friday is an event open to our community from 12 o'clock to 3 p.m. We have music, we have games to invite families in. And as you mentioned, it really is about awareness and testing and getting to know us. We're a primary care clinic. We are accepting new patients, and we have open access on Tuesday, Thursday evenings, and we'd like people to come out on Friday and spend some time with us.
You mentioned you're accepting patients. I heard you talk about families. This could be from the little kids on up?
So currently adults, but we will start serving children later this year. And as I mentioned, we really would like to get the community to know us better and visit us on Friday.
How about in terms of insurance? Is that an issue?
So what makes Trillium Health different is our first question is not, do you have insurance? It really is, how can we help you? And so we take care of the uninsured, and we'll figure it out. We'll figure it out later.
Okay. Yeah. Make sure you get the health questions answered first. And a lot of it is the being proactive, because lots of times people think, oh, if I'd only known about this sooner, and sometimes that means getting them in front of people who can make those diagnoses early.
That's right.
It's this is a health checkup day, and designed to do what you just said. We'll be doing things like blood glucose screening, blood pressure screening. We can do testing for HIV, sexually transmitted diseases, and also give out health information. Our dietitian will be there to talk about nutrition, weight management, and our pharmacist is available to talk about medication.
I want to talk about HIV for just a moment, because I know the governor has a push to really change the numbers. Is it 2020?
Yep, 2020. The idea is, the goal is to decrease the number of new infections in New York State to under 750 a year. And we are poised to be a part of that regionally. One of a number of places in New York State who are developing programs. We've been doing this since 1989, HIV since 1989, and New York State has been doing it for much longer. So this effort builds on this 30-year activity in the state to really make a difference now and bring HIV to low levels.
So the foundation has been built, and now hopefully we'll see the results in the patients.
Right, we're going to finish the job over the next 5 years.
That's exciting.
Very excited.
Especially for our community that's really been touched by this, hasn't
Absolutely.
That's right.
In terms of, I'm thinking about, moms trying to manage, kids along with them. How long do you think someone should set aside? I know this is going from noon to 3, but do you have any idea how long it might be for a patient to see someone if they're trying to allot their time on Fridays?
We can move them through as quickly as they need to be.
Okay.
So I'd say, but plan on spending half an hour to get the real benefit of not only some of the screenings that might be right for individuals, but also some health information.
Yeah, and we have a lot of volunteers helping us on Friday, both staff and community volunteers, to make sure we can get people through.
If for some reason people can't make it Friday, is there a way they can follow up with Trillium Health after?
Well, absolutely. On appointment, if they'd like to make an appointment with us. And as I mentioned, on Tuesday and Thursday evenings, we have open access.
Wow.
No appointment necessary.
Walk in.
Yeah.
So no excuses.
No excuses. We're here for you. That's right.
If they don't have half an hour to spend, we'll express them through and tailor it to the individual. Sure.
We appreciate it. Thank you so much. We'll be back with your local headlines in a moment.